Hello, my name is Sydney and I am in the Functional and Integrative Nutrition program, and today I'm going to be talking about SIBO, or small intestine bacterial overgrowth. So SIBO is a condition of dysbiosis or imbalance in the gut when there is too much unwanted bacteria in that small intestine, and it can be caused acutely by antibiotic use, narcotic use, infection like food poisoning, and it can also develop over time when there is unmanaged stress, chronic constipation, medication use, or even things like low stomach acid or things that impair proper digestion. Some symptoms of SIBO, most of them are GI related, gastrointestinal related, so bloating, gas, constipation, diarrhea, acid reflux, food sensitivities, nausea, things of those sorts. Some people also experience weight fluctuations, so things like weight gain, weight loss, and even just overall inflammation and bloating. A lot of people experience energy loss, so fatigue. Some people experience headaches, malnutrition from lack of digesting, breaking down, and absorbing our nutrients properly. Brain fog, skin rashes, like I said, nutrient deficiencies, and just that overall inflammation. If there are any other underlying conditions, they will likely be exacerbated by the stress that is put on the body from having this SIBO. For SIBO testing, it used to be the gold standard to do a duodenal aspiration, which is an invasive procedure. Luckily, there is an alternative that is non-invasive that is now being used more frequently, which is the breath test. And the breath test tests for methane, hydrogen, and hydrogen sulfide gas after drinking a sugar solution called lactulose. So if SIBO is present, the sugar, lactulose, will cause fermentation and gas, bloating in the gut, and this breath test will detect what kind of gas is being produced. This is useful for knowing how to build a treatment plan so that we can target the appropriate bacteria, whichever one is present and overgrown in the gut that is causing these symptoms. If you have SIBO, there are 3 different areas of treatment. So obviously nutrition and diet, lifestyle, and then supplementation. So for nutrition, obviously removing any food sensitivities or any food triggers. A lot of times this is gluten, grains, sometimes things like onion and garlic are triggering for SIBO. Things that you are reacting to, remove them, obviously. And then it also has been found that a low FODMAP diet is beneficial for the treatment of both IBS and SIBO. Following a low FODMAP elimination diet for about 6 weeks and then reintroducing foods as tolerated is the typical protocol. And obviously keeping those triggers out of the diet, things that continue to upset your stomach or trigger symptoms in the future, keep those out of the diet. And keeping highly processed foods, highly refined foods like sugars and oils and grains that are highly processed, highly refined, keeping those out of the diet, and increasing probiotic-rich foods like our lacto-fermented vegetables, as well as gut healing foods like bone broth. For lifestyle recommendations, reduce any unnecessary stressors. SIBO is placing stress on the body already, and healing from SIBO, healing from anything, is always slowed by this chronic stress. So reducing any unnecessary stressors from your life and practicing belly breathing before meals particularly can be beneficial to get yourself in a rest and digest state, or that relaxed parasympathetic nervous system state before eating, so that we can properly break down and digest our foods. Properly chewing your food, so chewing your food enough, breaking it down. Digestion starts in the mouth. We have enzymes to break down our food in our mouth and our saliva, so starting there, and then reducing liquids before and during meals, because when we consume liquids while we are eating, we're actually diluting our stomach acid, so weakening the stomach acid. And we want that stomach acid to be robust and breaking down our food as we eat. Spacing out meals and avoiding snacking in between to allow our digestion to optimize. So there is something called the migrating motor complex, which is a wave of peristalsis, which is contractions through the intestines that pushes everything through the intestines. And this only kicks in after about 2 to 3 hours after eating. So fasting for that 2 to 3 hours in between meals will help push along your digestion more frequently. Focusing on restorative exercise like mobility, walking, and stretching instead of high intensity, more stress-inducing exercise on the body as the body heals. For supplementation, I like to follow a weed, seed, and feed method for most things, using an herbal antimicrobial such as berberine to weed or kill off any unwanted bacteria in the gut. And then for seeding, we're seeding beneficial gut bacteria with prebiotics. And then for the feeding, we're feeding those prebiotics with probiotics. Using digestive bitters and or digestive enzymes is also useful to support digestion and just really promote the breakdown of our food before it gets into the rest of our digestive system. And then ginger has also been used to stimulate peristalsis and improve motility, which is how fast and effective our food is moving through our digestive system. And a huge part of the issue in SIBO is that food sits in that small intestine and is fermenting for too long, and thus creating gas and bloating and other symptoms. So improving motility is definitely a priority. And it is always important to evaluate the root of the problem, especially when it comes to SIBO and gut issues. What caused the SIBO in the first place? And how can we avoid it? Because if someone is consistently eating a highly processed food diet, or they're not managing their stress properly, or they're dealing with chronic constipation, whatever it is, that caused the SIBO in the first place, if it isn't addressed, then the SIBO will come back even if you do treat it. So, like always, addressing the root cause of the issue.